If you are to quote unquote interview a therapist for your child with FND, then the first question is this: are you familiar with FND? And or have you treated patients with FND? If the therapist says, I don't know what it is, then you have the answer, right? Next, move on. If the therapist says, sure, I have worked with them, then the next question is, okay, one, check mark. The next question is, do you work with teens, right? Or what is your sweet spot age range to work with in your practice? You can absolutely ask that question. You can ask two more questions. One is, how do you treat patients with FND? So specifically, we're asking about modalities, like, do you use cognitive behavior therapy? Do you also include parent training? Do you also work with school? Do you also work with other doctors who are involved with your child's care? That kind of thing. So what are the typical modalities? Like, how do you typically treat the patients with FND, let alone teenagers? And lastly, but definitely not the least, what are the typical outcome of patients with FND? So let's just say that you met with a therapist and this therapist says, yes, I work with FND. Yes, I work with teens. Yes, it's pretty good chunk of the, caseload. Then what are the typical outcome? Like what happens when you work with your clients who have FND and how do they end the treatment? I wouldn't necessarily ask how long it takes because how long it takes really varies. So I did talk about this in my other video that when you're stuck on timeline, then you're basically going to lose the game. So don't even worry about how long it's going to take because it really varies. So with my case, the shortest time it took me to treat a patient with FND was like literally 3 weeks. 3 sessions, 1 week apart, and bam, that's it. Completely resolved.